Thank you, Janice. I am really excited today to welcome Davis Phinney Foundation and our participants here for this wonderful event. My name is Anubha Sood, and I um, run the Total Care program here at the O'Donnell Brain Institute at UT Southwestern Medical Center. The Total Care program is a supportive care program for our Parkinson's patients and families. And what we've been doing for the past 6 months or so is bringing all of these wonderful resources to our community here because we don't want to replicate all that's been happening in this community across the nation and locally. We want our patients and our care partners to hear conversations that are happening and learn from, really experienced and learned people like, folks here at the Davis Phinney Foundation. So I'm going to quickly introduce the Davis Phinney Foundation and then leave it to Polly Dawkins, who's the executive director of the foundation, to say a few more words. So the Davis Phinney Foundation has been helping people with Parkinson's live well since 2004. They have a lot of important programs, research, content, and events for those affected with Parkinson's disease. The Davis Phinney Foundation community includes people living with Parkinson's, Parkinson's care partners, families, and friends of those living with Parkinson's, physicians, and allied health professionals. And Polly Dawkins is the executive director of the Davis Phinney Foundation for over a decade. Recognized as a tireless advocate, Polly's deep-rooted ties to the community, forward-thinking vision, and unwavering compassion for individuals living with Parkinson's have played a pivotal role in meeting the foundation's goals for providing actionable tools and resources to enhance the quality of life for those affected by Parkinson's. So I am very excited and honored to welcome Polly and Eddie to this conversation. I will introduce Eddie, or I'll let Polly introduce Eddie. So we'll start the conversation now. Polly?
Thank you, Anuba, and thank you for inviting us to be here today to talk about one of our favorite and most beloved resources at the Davis Phinney Foundation. Before Edie and I jump into that, I would I'm thrilled to introduce my friend and fellow advocate in the Parkinson's community, Edie Anderson. And Edie and I have known one another, I think, since 2015. Mm-hmm. And we met at an event together. And I saw this this amazing person who represented everything we at the Davis Phinney Foundation believe in, which is self-efficacy, which is taking action to live well. She represents what it looks like, or one version of what it looks like to live well with Parkinson's. And Edie has been an ambassador leader for the Davis Phinney Foundation since that time. She was recruited into our first cohort of ambassadors. I think there were a dozen people who were part of our program in the beginning. And with that program now, ambassador leaders, grassroots community leaders, has grown to close to 130 individuals. And our friend Jim Armington, who's on the screen today, is also in your community, is one of the Davis Phinney Foundation ambassadors. So I could say more about Edie and all of the things, but in our talk today, I think what she does and her approach to living with Parkinson's will come out and will shine. And I have to give her props. She was the one who put together the outline for what we are going to talk about today. She did all of the work, and I'm showing up to be her sidekick. So thank you, Edie, for being here.
We are so lucky to have you, Edie. Thank you. Thank you for coming and doing this for our Dallas community.
Thank you. Would you like us to get started? Or
yes.
Anybody? Okay.
Let's start, yes.
Super. So We're here today. Anuba asked us to come and speak about a resource that we have produced. We first produced this manual called the Every Victory Counts Manual, was first published in 2010. I'm going to hold up a copy of it here today. This is the copy of the manual. This manual has taken many forms over the last 14 years and is distributed today in four different formats. It's in this printed format, which is probably the most well-used format because it is so useful. It's also it's so useful to read. Many of us prefer reading books as opposed to digital on the screen versions, but we do have a digital version that you can download as a PDF. We also have an e-reader version, so you could read it on your Kindle. And then finally, we have it available read aloud as a podcast, chapter by chapter. So there are many ways that you can access it. For our friends who are in Canada, we have a French-Canadian version. We have a version for the English Canadian, but that has been adjusted for the Canadian community. Their healthcare system is different than the US healthcare system. So those are the ways you can consume this resource. This is what this resource is. And this was really, it came out of a vision that Davis, our founder of the Davis Phinney Foundation, as a young person diagnosed with Parkinson's at the age of 40. And really, when he was diagnosed in the year 2000, there was very little available to him and his family that talked about how you improve quality of life. And the diagnosis, as many of you know, was simply, you have Parkinson's, take these medications, quiet down your life, and we'll see you in 6 months' time. And he knew anecdotally and through his own investigations with his own body that advice was just not sufficient. And we fast forwarded into the mid 2000s and really understood that and heard from our community after doing many focus groups, many focus groups, what people needed and what people wanted was a guidebook, a way, a path to help them on their journey to live well with Parkinson's. And that's why we developed this book. And a few years later, we produced a companion book, which is called the Every Victory Counts Manual for Care Partners. And these two manuals go together. And we have just as many manuals for care partners that are distributed every year as there are the original manual, which is pretty exciting to know that our care partners also need the information on how to live well and support for themselves and for the person they love and are supporting. So I think that's sort of the overview of what this is. And I neglected to mention, this is free of charge. So the work of the Davis Phinney Foundation, the fundraising we do, the grant seeking we do, the sponsorships we do, everything we do, enables us to do the work that we do for free to our community. So we want no barriers between you accessing the information, no financial barriers or any other barriers to getting this, unless English isn't your first language, and then that's still a barrier to getting this information. So I thought Edie suggested that I start by reading the opening message from our founder, Davis Phinney, in this manual. And then I'm going to really warmly introduce Edie and have her share her story. So I'm going to take my book and I'm going to turn to a page in the book and it's a message from Davis. And Davis says, my message is one of sport, cycling specifically. The Olympics, the Tour de France are my former domains. I learned a lot about myself through the years of competing successfully in tough, demanding events. I came to understand the importance of focus and purpose and that paying attention to and being engaged in the process is just as important to achieving goals. I came to understand that victory, that elusive, electric moment of triumph, was not exclusive to those who crossed the finish line first. These are the lessons rooted in me, and they help me now in the much more challenging race against Parkinson's. This race is a no-holds-barred, winner-take-all type of event. It demands everything from me. If I let down my guard, it'll knock me flat. But when I refuse to give in by exercising daily, eating well, and most importantly, maintaining a positive attitude, I always find ways to win. I've had Parkinson's since 2000, plus another 10 or so years pre-diagnosis. And what I know is this: we can improve our quality of life. It takes work and commitment. It takes patience and support. It takes education and understanding. And it takes a roadmap, which is precisely what this manual is. If there's an upside to Parkinson's, it's that I'm constantly meeting members of the Parkinson's tribe who are exploring new ways to live well and better than they ever imagined. I know people who climb mountains, run marathons, and even ride their bikes across the country. Others find victory in spending time with their loved ones or walking around the block. I've met singers and songwriters, painters and poets. The commonality is their motivation to keep living an inspired life. Ultimately, it's not the size of the victory that counts, but the acknowledgement of every victory and the incentive it provides us to keep seeking ways to win. It's about what we can do today to improve our lives, and that is a victory in itself. And now, my friend Edie Anderson.
First of all, I want to thank you both, Anuba and Polly, for that introduction. You're very kind in your words. I'd like to start off. I've been asked to basically share my story, my journey with Parkinson's. I could talk about that for the whole hour, but I'm going to give you a very, very short version of it. I like to refer to my story as stumbling blocks or stepping stones. And it's about how to change insurmountable objects that get in the way of life, from boulders into stones, but not by physically pulverizing and changing the stone, but changing our approach, changing our attitude, making an action plan to figure out how to get around the obstacle so it doesn't stop us in our path. And so we're going to apply this then to dealing with health issues. And I'm not a healthcare professional, but I speak with a little bit of experience. I've had 15 surgeries under general anesthesia, and I've got 35 surgical scars as a result of that. Actually, a few more if you count the fact that I went to the dermatologist last week and she did a little slicing and dicing. So let's begin. We're just going to rewind the tape back to 2011 when I dealt with one of the biggest health issues of my life. The setting is my husband and I were sitting in the doctor's office waiting for some test results. And he walked in and he pulled up his chair very close to mine. When he sat down, our knees were touching. That's how close he was. And he leaned over and he said, "There's no easy way to tell you this. You have breast cancer." And I just sort of took a little breath in. My husband next to me went, "Oh," so he gasped, but I was a little more in control. And then the doctor did something I will never, ever forget. And it made the biggest difference in how I handled the problem. He leaned in and he went like this, "Look at me." And I opened my eyes and he said, "We can fix this." And he said it in all capitals. You know, he said, "We can fix this." And I responded simply by saying, "Okay." And essentially we entered into a contract at that point because he stated what he was going to do and I agreed with it. And as a result, we set in motion the medical plan for battling the cancer. And I have to tell you, it was the most difficult year of my life. It involved several surgeries. I did chemotherapy, lost my hair, was out of work for 5 months, all of those things. And it was a tough time. But I had the support of my family, my friends, my faith gave me strength. And those are all very important aspects of dealing with issues like this. The fact that we were able to win the battle, we got around that boulder, became more evident when I went for my 10-year checkup. And the oncologist said, if the cancer hasn't come back within the first 10 years, it's not likely to come back. She basically said, we fixed it. So that's the short version of dealing with breast cancer. Now, how does that contrast with what we're dealing with now as far as the Parkinson's? On the heels of winning that battle, when I woke up from my second surgery, I woke up and there was a twitch in my middle finger. Just an annoying little twitch. It wasn't real obvious, but I could tell it was there. And I asked my oncologist, I said, is this a neurological problem I need to, address? And she said, oh, no. She said, it's probably just some local nerve damage because the chemotherapy did leak into the tissues in my arm from where the IVs were placed. And I, had some chemical burns, and she said, it's just a result of that. It'll go away. Well, it didn't go away. It kept progressing. It kept getting worse. And one day I was at my primary care physician's office, and I asked him, I flat out said, is this Parkinson's? Well, his answer reflected the fact that in med school, he probably only spent about 15 minutes on the subject of Parkinson's. And it's not his fault that he wasn't up to speed, but his answer to me was, oh no, it's not Parkinson's. Parkinson's is when you shake on both sides. He says, you're only shaking on one side. Wrong answer. But fortunately, he and I had a good rapport. And over the years, he thanked me for all the things he learned about Parkinson's because he was just not familiar with it. And the information I shared with him, most of it came from the Every Victory Counts manual. So even doctors can learn from the book. So a year and a half went by, and I finally got that referral to see a neurologist. And the man was an awesome doctor. He spent an hour and a half talking to me, examining me, watching me walk, watching me react to different things. And at the end of that hour and a half, he, like the first doctor, leaned over and said, I'm sorry to have to say, you've got Parkinson's disease. And then I waited for it. I waited for this. Look at me. And I waited for him to say, we can fix this. But that didn't come because, well, he can't fix what he can't fix. And as we all know, there's no cure for Parkinson's. So that kind of really hit me. At that point, I was facing a stumbling block. I didn't know how to deal with it. I didn't know how to go around it. I didn't know how to get over it. And it not only stopped me in its tracks for a while, but it felt like a millstone tied around my neck, and I sank into a pity party. It's funny, that's an interesting term because party, not so much, because there are no other guests. You don't play any games, and there's certainly no cake. So it's not much of a party. But that's what we call it because we fall into this pit of despair where we kind of are in this darkness for a time. And I've spoken to people who say they've been in the party for 30 seconds. And I've spoken to people who, like myself, I was in this denial for almost a year. During that time, somebody suggested I go to a Parkinson's support group meeting for some help. And at this point, you might be wondering, well, wait a minute, what happened to all your friends and your family and your faith? Well, they were all still there. They were all doing what they could to support me and to encourage me and to reassure me that I was loved, but they couldn't feel what I felt. They could sympathize, but they couldn't empathize. And when you're dealing with a long-term condition that has no cure, you really need to get in touch with a community that shares the same things. And that's why being part of a support system is so important. So I started attending a local support group meeting. And I met two very important people that changed the course of my life. The first person, her name was Kathy. And after listening to me whine for quite a while, she finally looked at me and she says, "You know, I'm going to tell you something." She said, "Pay attention. These are the cards you've been dealt. Play your cards and play to win." And when she said that to me, it struck me. And I realized I've been waiting for someone else to figure out what I should do. And she was letting me know that had to come from inside me. That had to come, I had to figure out what was right for me. I had to make the choices that were going to affect the quality of my life. And that really made a big difference in the way I saw things. And the other person that I met, his name was David. And David was responsible for introducing me to Polly. And that was, like I said, it was life-changing. Polly invited me to participate on the panel discussion. It was the Partners in Parkinson's Conference in Washington, D.C. I believe it was in the spring of 2015. And the panel discussion was about the benefits of exercise and good nutrition and Parkinson's. And it was a wonderful conference. And I was so excited about being there and learning all the things I did and being a part of it. And when it was over, I still remember Polly asked me, she said, "If I ever need your help for anything, can I call on you?" And I simply looked at her and said, "Yes." And 6 months later, I think it was later on that year, it was in the fall of 2015, as she mentioned earlier, they set up the first cohort of ambassadors, and I was invited to be part of that group. So I became part of the Davis Phinney Foundation tribe, as they like to call it. And I've gotten so much encouragement from Polly, from Davis, from Connie, from all the people that are there. And it's been a wonderful experience. And in turn, I've been able to encourage other people to live well, because just because we have Parkinson's doesn't mean life is over. Some of the books I read early on that aren't as unique as the Every Victory Counts manual, it seemed like the message was that when you get diagnosed, you have an expiration date at some point. And I thought, that's not right. That's not the way I do things. And fortunately, the Every Victory Counts book focuses on actually living well, not the fact that at some point there's an expiration. But it's been really just such a blessing. And to kind of bring this to a conclusion, going back to the title of my presentation, Stumbling Blocks and Stepping Stones, that boulder that was in my way when I got diagnosed in 2013, long since has become a stepping stone, because I figured out an action plan. I figured out how to have a positive mindset. And I realized that on the other side of that boulder, there was still a life to be had. There were adventures to be had. There were things that I could do. You just have to maybe make some adjustments. And if you're flexible, then you'll be more successful. And the Every Victory Counts really is all about victories, whether that's simply being able to walk to your mailbox one day or to climb a mountain. There's really nothing stopping us from doing the things that we really want to do. So that's my words of wisdom to you.
That's a great story. And I love that analogy between your diagnosis of breast cancer and your diagnosis of Parkinson's, and how different those diagnoses and stories were.
Thank you.
Edie, you mentioned at the very last piece of what you were talking about, you were talking about what the Every Victory Counts manual is unique. It's different from the other books that you read. Can you help folks understand what makes this manual unique? What's different about it?
Well, a couple of things come to mind. The first one doesn't seem like a big deal, but to a person with Parkinson's, it does. And that has to do with the design and format of the book. I have all of my Every Victory Counts manuals that I've ever gotten. And when I first started, excuse me, it was the 3rd edition. Here's my 3rd edition. And excuse me, I seem to have a frog in my throat. The first book I have is all pretty much the same color as far as the pages. There are different sections, but it was difficult to find what you were looking for, partly because the numbering system was a little odd. If you went to the bottom of the page, it wasn't numbered in sequential numbers like from 1 to 400. It was numbered in section numbers and then pages, and it made it a little difficult to find what I was looking for. So when they went to make the revisions, I need some water. One of the suggestions that was made, and they asked us ambassadors for advice because, well, we're the ones that were using the book. And so I don't know if you can see this, but let me show you. See the different colors? They then decided to color code the book in sections, which made it easier for us to find the information. And then the page numbers became much more obvious. If you can see on the side, the numbers were put on the side of the page, in the middle of the page, which is actually easier for us to see visually than to look at the bottom. So just some simple changes like that made it more user-friendly. And so I wanted to kind of make that point. The Every Victory Counts manual is unique in that it has a holistic approach to living with Parkinson's. Parkinson's is a disease that you manage, and you manage it medically, you manage it with exercise, you do whatever it takes to nourish yourself, in various ways. As a matter of fact, there's a definition in the book that states what wellness really is, and that wellness deals with 3 different aspects of our health. It deals with the physical, the emotional, and the spiritual well-being. And those things need to be balanced in order to truly live well. And the Every Victory Counts focuses on that. It's not just about conventional treatments, but it also talks about alternative approaches to healthcare. And so it really does cover a lot of bases. The third thing that makes this book unique is the fact that they have pictures and comments from people who have Parkinson's throughout the book. Now, my first edition, as I showed you earlier, was this one. The pictures on the front, I have no idea who these people are. I don't even know if they had Parkinson's. Polly might be able to say.
Yep, they do. Yep, they do.
But, for all I knew, these were just pictures, of actors. But in the new, let's see, which one do I want to show you? Well, even in the 5th. When they made the changes to the book, then as you go through it, there are little button pictures as well as larger pictures of the various ambassadors, their caregivers, their husbands, wives, and so forth. And for me, it helps me make a connection because, first of all, I know these people. And second of all, their little words of wisdom make all the difference in the world because I can relate to what they say. Mm-hmm. So the book for me allows me to have a connection with the Parkinson's community. And so that's what we encourage everyone to do, because when you don't feel like you're alone in this, then you know, that gives you the strength to keep on going. So connections are important. And then the last thing that makes this book unique is that it's not just an academic book or a book about research and medical information, but it's a practical guide to living well with Parkinson's. And it's written in a format that we can understand, even though it does incorporate medical research and medical information, but it doesn't go over the head. You know, it's written for us to be able to understand. Now, I want to show you something. The book only works if you use it. So let me go back to my first book again. Okay. I cherished this book. It was the very first Every Victory Counts book that I got. I did read through it and I learned a lot from it. But guess what? I kept it in pristine condition. I didn't make a mark in it. I treated it like, well, like a coffee table book because I felt it was just so special. But in order to really benefit from something, you've got to take it apart. You've got to mark it up. You've got to really kind of dog ear it and, you know, show that you used it. So here's my next copy. This one, when I got it, I tabbed, I've got all these millions of little tabs. It's highlighted practically on every page. There are notes written in the margin. So it's well worn and well used. And this is the one that I got the most out of. I actually used this one when I did some teaching. I did a little Parkinson's 101 class a few times. And that's, you know, that's how you get the most out of a book, is to really just kind of wear it out. So we often refer to the Every Victory Counts as the Parkinson's Bible. And if I may, I just want to share something with the group. I have a little plaque on my desk that says, if your Bible is falling apart, chances are your life is staying together. And you can substitute the word for EVS. If your EVS is falling apart, chances are your life is going pretty well. And I really believe that, because the advice only works if you apply it. And so those are the things that make this book unique for me.
Thanks, Edie. That's great. I also remember years ago, I think it was you who took the manual and read it from back cover to front cover and copy edited it for us once it was published.
Yeah.
And pointed out some of the errors, grammatical, spelling, typos, which of course was heartbreaking because we had gone through the process and printed it and got it out. And Edie sent us a whole list of, I found all these things that need improvement in the book, which I've never seen a community member, somebody take such dedication to this, to something that we do and say, I love this so much, I want you to make it better. And this is how. And I think that's an extreme example. It was incredibly useful. The other examples that Edie uses about, it talks about involving people with Parkinson's and care partners in the development and the improvement of this manual. It just keeps getting better each time we publish a new edition. And we don't publish a new edition every year. We produce a new printing. But doesn't mean if you have an edition from 2 years ago, you need to replace it. It simply means that we ran out of print. And the medication section does get updated every year, and that's available separately. You don't have to get a new book. But yeah, that was you, Edie, wasn't it?
I can't believe you remembered that.
Oh my gosh.
I did. I read the book backwards, which I don't even remember who told me that when you do that, then you're looking for the words that are out of place in the spelling, because when you're reading it from front to back, you sometimes assume that things are, written correctly. Anyway, I did do that. I felt badly that I sent all those mistakes to you, but.
Are you kidding? I mean, who does that? That was amazing. That was truly amazing. Well, perhaps it makes sense to segue into what's in this manual. We've talked about why it's been so beneficial to folks and Edie's story and how she has used it and what makes it unique. So perhaps I'll go through a little bit about just highlight what's in this manual for those of you who haven't seen it and would like to order one. For those of you who have seen it, it might be a nice reminder. And Anuba, are you okay if I share my screen for just a quick moment to look at the table of contents so
Yes,
people have a
absolutely.
visual? All right,
Absolutely.
so bear with me here. And then if you could, somebody give me a thumbs up that you can see my screen. Can you see my screen here? Okay, so here's the table of contents of the Every Victory Counts manual. And I'm going to blow it up a little bit more and so that you can see it a little bit better. All of us, I think, are probably challenged with our eyes and seeing it. The actual physical copy of the manual is written in nice large font. The feedback we've received is that easy to read, nicely spaced words and sentences make this very easy to consume. So the table of contents, there are really three main sections in this manual, and as Edie mentioned and commented, each section is in a different color to make it easy to reference. So the purple section, or section 1, is really about living with Parkinson's. It's the basic information about the symptoms, the 101 of Parkinson's. This is where you can go to say, what is Parkinson's? How do we get testing of it? What is it like if you've got young onset Parkinson's, if you're living alone? What are treatments available? Um, and all your symptoms, your motor symptoms, your non-motor symptoms, or the emotional and cognitive and autonomic symptoms. Those are all in the first section. So the first section is really the basics of everything you need to know about Parkinson's, and from a perspective of living well and a perspective of taking action. What do you do if you have neurogenic orthostatic hypotension, for example? Now, just because it's published in this book and we talk about it, doesn't mean that everybody will experience these symptoms and experience all of these challenges, but it's laid out for you in a way that you can access should you want to access it in the future. Throughout the manual and throughout each section, we've in italics, we've drawn your attention to sections that are written by others, stories that are written by people like you, and also from experts. There are over 50 experts who've contributed to the writing of this manual. So movement disorder neurologists, exercise professionals, physical therapists, occupational therapists, nutritionists, dietitians, chaplains, and others. So those are all highlighted here in the italics. The section 2, or the orange section, is really all about the treatments and the therapies that you can consider. And this is the section that is probably the most changing. And on the Davis Phinney Foundation website, we keep the medication section updated as well, so that you can download that. You don't have to go get a new book unless there's a major change. So this is about the medications, how you manage your medications, about dyskinesia, about medications for motor symptoms, non-motor symptoms, and then about hospital stays. Also, really importantly, which medications to avoid. And that's something I don't think gets talked about enough. The medications that are contraindicated in Parkinson's, those medications that can conflict with your Parkinson's medications or can worsen your Parkinson's symptoms. We go into surgical therapies, the different kinds of surgical therapies available, a deep dive into those. of course, our favorite, which is exercise and why exercise is so important to people living with Parkinson's. We also talk about complementary therapies, physical therapy, occupational therapy, speech and swallowing therapies, other complementary therapies, and why those are important part to your overall well-being. And last but not least, in that section, we talk about nutrition and diet and eating. Finally, the last section talks about more on living well with Parkinson's. So your emotional health, your social health, relationships and community, talking about Parkinson's with your work, talking about Parkinson's with your children, your relationship with your care partner. And then we have overall health and wellness. And then some of the things that people have told us they want to know about finances and long-term care, financial planning, and then, what's beyond today, living well beyond today. We decided a number of years ago to include an article written by Dr. Benzie Kluger called The Medical BS Detector, which is, oftentimes we get asked by, I'm gonna close my share screen there. We get asked by our community, oh, what about this thing? And I've heard about this. And what about supplements? And what about this cool stem cell therapy treatment? And that chapter by Dr. Benzie Kluger is really meant to empower you to improve your own detection for what he likes to refer to as BS. How you should be cautious about the snake oil that's out there. And we're all so eager to find something that works for us. This is to improve your skills in detecting what might not actually be useful, what might be a money-making scheme out there, what might not be medically proven. And so that's the last section in the book, along with a glossary and index and notes, how you can find information in the book and access it. Edie, does that cover what you
I think
imagine?
everything. As a matter of fact, now that you've reviewed the table of contents, why don't we show the folks kind of how you would use it? Why don't you be Dr. Polly and I'll be the person with Parkinson's? Oh yeah, that's me.
And
so,
just for clarity, I'm playing a doctor. I am not a medical doctor.
So Dr. Polly, you've just told me I have Parkinson's disease, but I have no clue what that is. Can you explain it to me?
Well, absolutely. And I'm playing a doctor who did not go to get extra training in Parkinson's. I am not a neurologist, and I am not a movement disorder neurologist, which is the ideal person Edie would be seeing. I'm probably her primary care physician, and maybe I've just given her a diagnosis. So luckily, I've been given a copy of the Every Victory Counts manual to reinforce what I know. So I'm going to turn to page 25 in the book, and I'm going to say, well, Parkinson's is a brain disorder, Edie, that is associated with the loss of dopamine neurons or dopamine producing nerve cells. And then I'm going to go through that and tell Edie all about what that means, the damage that affects the brain, the fact that it's a neurodegenerative disease. And then I'm going to tell her how I made that diagnosis, which again is right here in the book. I'm going to have looked at her slowness, stiffness, her tremor, postural instability, and that's how I've made a diagnosis. So those are the things I would highlight to Edie as I'm role playing with her.
Oh, sounds pretty serious. But how did I get this? I mean, was I exposed to a virus? Is this a contagious condition? I mean, where did it come from?
And, Edie, there are no known exact causes for Parkinson's. Yeah, it's a mystery, in fact. Although there are many thoughts that you might be genetically predisposed to Parkinson's. You might have a genetic mutation. And one of the things you might consider is genetic testing, and to understand whether you have one of these genetic mutations, and if so, how to approach that and get genetic counseling. The other thought is that, yes, you might have been exposed to something in the environment. And that's the predominant thinking, Edie, is that you might have been exposed to something in your environment. You might have been exposed to an herbicide, a pesticide. You might have been exposed to a head injury, multiple head injuries.
Yeah.
Those are other environmental factors we know about Parkinson's. So the analogy sometimes is genetically you might be predisposed and set up, but the environmental exposure triggers your Parkinson's.
I get it. Oh, that's a bummer.
Yeah.
Is this kind of like cancer where there are different stages?
Yes, and once again, because I'm not a movement disorder neurologist, I would be turning to page 37 in my manual, and I would be talking to Edie about, yes, there are different stages of Parkinson's, and they're generally grouped into sort of early, mid, and advanced stages of Parkinson's. There, if I were a movement disorder neurologist, I might talk about Hoehn-Yahr stages. I might talk about stages 1 through 4 or 5. But we, for this discussion, really focusing on early, mid, and advanced. And early stages of Parkinson's would be symptoms on one side of your body. Yeah, so you said you had tremor in your middle finger, one side, and maybe a decreased arm swing on one side, or a decreased stride or gait that's affecting one side. And probably early stages, you might find small handwriting or a change in your facial expression. And certainly in that early stage of Parkinson's, you would probably have your pre-motor or your prodromal system symptoms that you had before your diagnosis even occurred. So Edie, you might be experiencing depression. You might be experiencing anxiety, sleep disturbances. And another really common prodromal symptom is constipation.
Yeah.
And, or loss of sense of smell. Those are all of the things we know come before the motor diagnosis of Parkinson's. So those are sort of in the early stages. And as you continue with your Parkinson's, that you can live for decades with Parkinson's, and you might move into a stage that has softer speech and symptoms that have moved to both sides of your body, and maybe some mild swallowing problems, and your postural problems.
There is one problem that I've noticed, and it really bothers me, is my balance. Is there anything I can do to fix that or make that better?
Absolutely. And I'm sure those of you who are watching this on this call have experienced balance issues. And balance, some of the challenges with balance, it's very personal, very individual. So the first thing I recommend, Edie, that you do is to get a consult with a physical therapist.
Okay.
And your physical therapist will help you establish a baseline. And a physical therapist will also help you develop a physical therapist with experience in movement disorders or neurological. So a physical therapist who's somebody who helps you with your knee replacement is not the physical therapist you want on your team.
I see.
Yeah, you want somebody who's experienced with movement disorders and who can help you train your weaknesses.
Uh-huh.
Because those are the areas, your strengths are your strengths, your weaknesses. So your balance, that's where your physical therapist will establish a plan. And we all know that physical therapy is not covered for the long term. So you'll work with a physical therapist and come up with a plan and see that person for as long as your insurance will allow you. And then you might consider working with an exercise coach or a trainer to continue those specific therapies or exercises
Mm.
as the year goes on. And then the next year, when your physical therapy restarts and you get
You could do it.
you could do it again. You can see your
Yeah.
physical therapist again, and then you might be training into other deficits because the ones you've been training might be really strong. So that I would turn to page 50, and those are recommendations from an expert, Dr. Helen Bronte Stewart, who talks about those.
Okay. One more thing I want to ask you. You say I have a brain disease, so the only doctor I need to see then is a neurologist. Is that right?
No, no, you really don't want to see a brain doctor for your gynecological issues because they
No.
did not train. Oh, yeah. Or you don't want to see a neurologist for your oral health. Your
Oh,
oral health is so important to your overall well-being with Parkinson's. You need to have a dentist on your team. You need to have a dermatologist on your team. You need
boy.
me, your primary care physician, on your team. I'm going to treat all of those other things that may have nothing to do with Parkinson's, but have to
Right.
do with our bodies as we age. You need your movement disorder neurologist along with a team of other people.
Wow. A team.
A team. Mhm.
Okay.
And that team, Edie, is going to change. That team might include a speech and language pathologist for a while. And then that person may come off your team once you don't need that. And so your team will also include, if you're lucky enough to have a care partner,
Hmm.
your team will include your care partner.
So pretty much anybody who helps me, supports me, and encourages me to do what I need to do.
Absolutely.
Yeah, I'm going to need a lot of help. All righty.
Exactly. Okay, that was our little role play, folks. Obviously, I'm not a doctor, so.
So Polly, could you mention a little bit about the benefits of using the worksheets that are provided?
Yeah. So so if you all have a copy of the Every Victory Counts manual, this current edition, and again, this current edition has been out for, I think, since 2021. There's no need to race out and get a new edition. This edition has been largely the same except for the medication section. However, the difference between this edition and one of the earlier editions that Edie holds up is that earlier editions contained worksheets. And these worksheets are, we believe, are instrumental in helping you really successfully manage your Parkinson's and manage your symptoms and your conversations with your doctor. Why are those no longer included in the manual? We wanted to make them available to you that you could go online and you could download them and print them and use them as many times as possible. In the manual, they were kind of stuck in the book. So we wanted them to be a place where you could go download and use them over and over. The manual, the worksheets, in fact, I went online today and downloaded them just to see how it worked. Again, it's been a number of years since I've done that. Very easy to do. We can provide you, and Anuba can provide you with the links to those worksheets for you to download, or for the manual itself to download or to order. Those worksheets include self-assessments. So you can You can have a summary of a goal summary with your doctor's visit. We've got a daily medication log, an exercise log, an overall journal and journaling, a nutrition self-assessment, a Parkinson's psychosis self-assessment, which is a hard topic to think about. We also have a deep brain stimulation self-assessment, a relationship self-assessment. We have a home safety checklist in those worksheets, a travel checklist. And then we have all sorts of checklists and worksheets on symptoms, very specific symptoms like constipation, bladder, dental, your dyskinesia and off worksheet, emotional wellness and anxiety worksheets, fatigue, gait, balance, swallowing, everything. So that if you feel like you've got a symptom and you want to track it and you want to be able to go into your doctor's appointment or just know for yourself, what is this that I'm experiencing? How do I track it? What we've tried to do is take the work off of you and off of your doctor and give you a place to say, oh, this is how I track it. This is how I think about this particular symptom, and then can keep an eye on it. And then we also have sort of clinical assessment summaries. So when you go to your doctor, you've got a summary of your appointments, your medical history, how to prepare for your hospital stay. So those are all contained in I believe it's 80 pages of worksheets. So it's a really, really helpful tool for you. And you can download them all as one, and you can print off whichever pages you need. You don't have to print off all 80 pages. So if you're saying, I just want a swallowing worksheet for now, you can go in and print that one. So that we think those worksheets are a important complement to the information found in the manual.
Yeah. Mm-hmm.
So Edie, how do you use you want to talk about how you prepare and use these tools?
Well, I think one way we can show the group how this works is I can demonstrate what you shouldn't do, and then we can contrast it with a better way of getting prepared for the doctor's visit. So I thought I'd do just a real quick soliloquy of talking to myself about my next appointment and see if people relate to what I say. So, oh boy, it's been a long week. I'm glad the weekend is here, and I guess I better check my calendar to see what's going on next week. If it wasn't for this little calendar, I'd be lost. I write everything in here. So let's see, June, today's the 28th. I have nothing going on this weekend, so that's good. Let's see, next week. Oh my goodness, Monday morning, I have an appointment with my neurologist. It seems like I just saw him a couple of weeks ago, but I guess it's already been 4 months. Oh boy. So let's see. I think let's see. I'm pretty sure he likes to review what we talked about, and I took some notes because normally Scott goes with me, but I don't know, he had something to do that day, so it was just me. So let me check my folder. I know I keep notes in here. Again, I have all these papers. Let me see. I don't see any notes. You know what? I get a printout at the end of the appointment. Let's see. I think I have that. Yeah, here it is. Maybe the notes are on there. Let's see. It talks about my medications. Blood pressure, heart rate, body weight. It doesn't give me what I need. You know, the doctor takes all kinds of notes and he sits there and puts them in his computer. So if he needs to know something, he'll just have to look it up. But I know they want me to limit what I talk about to 3 things. So what should I talk to him about? Well, I hurt from head to toe. I can tell him that. I don't like my tremor, so I want to talk about that. Let's see, a 3rd thing. Oh, no, I can't. I just can't talk. It's too embarrassing. I've got this issue with constipation, but I just can't talk about it. So I know, I'll just tell him I'm having insomnia. We can talk about that. So that'll have to do. So that's how not to.
Well, let's review why that approach that Edie just took is not an ideal approach, and why this resource that we're talking about could help her improve her approach. Okay, so Edie, I love that you have a paper calendar. That is a really great way to keep, I know, I keep paper too. A digital calendar can help you provide you adequate notice. It's Friday. You've got an appointment on Monday. That's not a lot of time to go back and review what's going on. So a digital calendar could help you with that and help you with a reminder. The second thing I noticed, you were like me at my desk here. You were going through zillions of papers, super hard to organize, isn't it? And hard to find.
Yeah.
And my recommendation to you would be to have a binder or a folder with all of your own notes, whether they're handwritten or digital, your lab reports, and then copies of these worksheets that we've talked about, the Every Victory Counts worksheets, so that you can go through them and prepare and go into that doctor's appointment on Monday morning. The other thing I would coach you on, Edie, is not talking about an appointment because it's embarrassing is not the best approach. You're not talking about constipation specifically, or even more embarrassing topics, which could be sexual dysfunction, reduce your quality of life. And constipation is such a human experience and such an important part of your Parkinson's meds and your Parkinson's, how your medications will work and how you feel. And so your doc can give you great strategies on how to deal with constipation, because relieving that will relieve a bunch of other symptoms that you're feeling. And then finally, I would say your doctor probably doesn't have time to review your chart in great detail before you walk into the doctor's office. And relying on them to remember all of the details of your last appointment is probably putting too much on them.
I see.
Yeah.
My job to do that.
You'll probably get a better outcome if you do that.
Yeah.
So let's talk about how it goes well. What strategy you and your care partner, Scott, have developed to have a successful doctor's appointment.
Okay. And I'll do an abridged version of this because we're running out of time. I want to make sure we have plenty of time for question and answer. So I just want to share with the group that in preparing for a doctor's visit, I review my journal, my worksheets. I kind of put together all the information about how I'm feeling and things that have, maybe side effects to certain medications, anything that I feel the doctor needs to be brought up to speed on. And I develop basically an agenda. I conduct a meeting, so to speak, when I go to the doctor's office. And the first part is all of my medications. And generally, I review that with the nurse when they come in, because they're the ones who ask if there are any changes. But when I see the doctor, I will point out to him, for instance, he made a recommendation the previous visit to change something. And so I will share with him, how did that make me feel? Did it accomplish our goal in working out something that was bothering me? He also suggested increasing some medication, which I am very sensitive to. And I reported back to him that I couldn't do it in the increments that he wanted me to because of issues with my stomach. But I was able to get to that level on a slower, like I increased it 1 crumb at a time, so to speak. So I share that with him. And then I review my health as far as my physical health, my mental health. I talk about the pain issue. Like earlier in the soliloquy, I said, oh, I just hurt all over. Well, that's a general statement that doesn't really focus on anything. So for this visit, I've decided I'm going to talk about my foot pain because I'm trying to walk more, but my feet hurt. And so I'm going to see if he has any recommendations for what I can do about that. So you have to be a little more specific when you're targeting certain things. I did talk about, I'm prepared to talk about the constipation, the gastro problems. I went to a gastroenterologist. He did some testing. He determined I did have some issues. He put me on medication. So we talk about that in more detail. Then the part about the mental health, it's important to be honest and open about that too. Talk about depression, the fact that it was a rough winter, even here in Florida. It was dreary, it was colder than normal. And so I found it difficult to wake up with a smile on my face in the mornings. It was a little harder. And then apathy, I talk about that with him. That's a difficult thing to even describe to somebody. But for me, aside from not having the motivation I would like for certain things, sometimes you just feel empty inside and you go through the motions, but you just don't feel like you're really putting your heart into it. So that's something that we discuss. Then I bring him up to date on all of my other medical issues. Like, for instance, if you have COVID or if you had any other kind of illness that affected the way you function. When I had COVID, it was like having the flu, but I had absolutely no energy for days. I couldn't even hardly walk. But fortunately, I bounced back. I talked to him about all my other doctor's visits because it's good to keep him apprised of the fact that, yes, I go to the dermatologist twice a year. I see my oncologist for my checkups. I go to the general practitioner. So as we mentioned earlier, it's a team approach. He's the captain of my team, and I want him to know what I'm doing with regards to all of my other aspects of my health. And then I also include a little part about activities that I'm doing. What kind of exercises am I engaging in? What kind of social activities? Because all of these help to improve our life, to add quality to the way we live. And so that's all part of the agenda that I share with my doctor. And when I do that, both of us benefit from it because he hears me give the report. I asked him one time why he doesn't do a lot of cognitive testing with me. And he said, I don't need to because you can conduct a meeting. So he sees that as part of the evaluation of how I'm doing overall. So I get a lot out of those meetings, and he spends a lot more time with me because I've made the effort to share all of this information. So I would encourage the people in the audience to really give attention to good preparation because that's when your visits are the most productive.
Yeah, and that sort of brings us full circle is education and information. That our goal, one of our goals at the Davis Phinney Foundation is to ensure that you all have the information that you need and the resources at your fingertips to help you make the most out of this hard and challenging diagnosis. And the more prepared, the more informed you are, the better your outcomes will be.
Absolutely.
And I want to contrast, Edie, I have a copy here of her agenda for her doc's visit. It's complete, but it's not a stack of information like this. It's complete, it's summarized, and it has her goals that she wants to address in that particular doctor's appointment. So it helps her movement disorder neurologist zero in on today or right now, these are the most important things that Edie wants to walk away from this meeting. To ask your doc, if you go in with a binder that's, that's this big, and ask your doc to help you determine what, make sense of that in what might only be a 15-minute appointment, is your outcomes won't be nearly as good as Edie's outcomes are. She went in prepared with, these are the 3 things I need to fix or improve to make my next 4 months even better. She's a perfect example of why this works, and this approach and the strategy works. And I would also nod to our friend Jim Armington there. Jim is another person who uses this resource, uses this manual to manage his education about Parkinson's. And they have very different stories, very different experiences, as you all do, but they've each taken an approach to being informed and being engaged in their own care.
Yep, that's the trick.
Mm-hmm. So we thought we'd pause there for you to stretch or take a drink of water or do what you need to do. And we are here to answer any questions. If anybody wants to come off mute, ask us questions. Again, we're not medical doctors, but we can answer questions, and probably Jim could jump in too and answer questions as well as one of our. So.
Well, I just want to say thank you so much for all that you have shared and how you shared it. It was so encouraging today for me to hear. So thank you.
Well, that was all Edie. I'm not going to take any credit. That was all Edie's approach.
Well, Edie, you're quite a special woman. For that.
She sure
I know more
is.
all of you are.
Well, I was diagnosed in 2018, and most recently, my voice has just diminished, and I was given a speech therapist, and my daughter is also a speech pathologist, and so she has some insight for me also, and she's here visiting right now. So I'm going to get off in just a minute. It's only till Sunday, and I want to make hay while I can.
Absolutely.
Something
Thanks for sharing that.
Just want to make a quick suggestion for you as far as voice. I recommend singing. I know that when there's music involved, I can sing louder than I talk, and that's and it also makes you feel good. So do some singing.
Oh, thank you for that. I feel that way on Sundays when I go to church.
That's where you want to belt it out.
I really can. I can feel a difference. So thank you for reminding me of that.
You're welcome.
Anyway, thank you so much. So anyway, I'm signing off now. I don't have the workbook yet, but my husband ordered 2.
Oh, wonderful.
Yes, so we may share one with one of my primary interns.
Wonderful. Well, thank you for being here, even though you have your daughter in town. Thanks for making this a priority.
She even sat in on most of this, and a friend of mine just showed up, and so she's over there visiting with her in the background. You may can hear them over me.
Yeah. Well, thank you.
Thank
Take
you.
care.
Okay, I don't know how to close that off.
Any other questions or comments? Or I noticed that Roger put a message in the chat, which was about environmental and genetic connections to Parkinson's, and he rightly points out that a much smaller percentage of people's Parkinson's is caused by genetic causes, that the vast majority are attributed to environmental causes.
Mhm.
I just wanted to say this has been so productive and so helpful for our community. And the fact that this is being recorded is absolutely wonderful, because I know I'm going to get a lot of questions and emails coming in about, I missed this, but and so we'll have this as a resource. And also want to attest to just the brilliance of this book, which I also have, of course, and the worksheets as well. And we are very excited to, from here on out, really push these, because, it really helps to know how to use this to really be able to also push them out and really get them the benefit that they can be. So Edie, you were so inspiring and so helpful. This has been wonderful. And please, if there are more questions, or if there are even questions later on, I will definitely do my best to respond, have, Polly and Edie, if possible, ask them, if there's specific questions there. And, we'll sort of continue this conversation, and very excited to partner with Davis Phinney Foundation and be able to do this. Thank you.
Thank you, Anuba. And thank you for giving Edie and me a reason to reconnect after we hadn't chatted for some months. So thank
That's
you.
been great. Thank you.
It's been a fun, yeah. All righty.
Okay.
Well,
We have just a few more minutes. I just want to make a couple of comments if I can.
sure.
Sure, that'll be great,
First,
Jim.
thanking Edie and Polly for doing this. And one of the first things I thought of when Anuba came to many of us in the Dallas area to talk about the upcoming initiative at UT Southwestern on Parkinson's total care program. And I think that's a great community activity and a great step toward the kind of world we want to live in. We want to be more connected. We want to be, it's such a diverse community and it's such a diverse topic. The focus that the Phinney Foundation has continued to focus on, and that's living well today with Parkinson's, I think is the most important. In fact, it may be where some of the new therapies and new medications actually come from, the knowledge generated by the community. And we want to make sure that that's well connected. And I think what you're doing, Anuba, is on focus for that type of a world, for maybe not immediately, but for our future. The living well today is such a complex topic that organizing it and putting it into one volume where you're going to reach out to people that had defined living well so differently among them. It takes an army of interpreters and contacts and empathy and people that can reach out to an individual. And so I've really enjoyed being part of the ambassador program in that regard. So thank you, Polly, for letting me continue. And,
Of course.
Work with you folks there, and look
We're-
forward to the
We're
next
honored.
big victory summits as well. So,
I just got back from Flint, Michigan this
Mm.
week. We did a victory summit in Flint, Michigan this week.
where's the next one?
We will be in Hartford, Connecticut in September,
Wow.
and then Green Bay, Wisconsin in October.
So can I share something that Davis said? It's been years ago when I first started with the Phinney Foundation, but it's something I think about a lot. He made the comment that as people with Parkinson's, we should hope for a cure, but don't wait for it. In other words, take action, be proactive, do something to improve your quality of life, because it's really up to us to make that leap into the future and what we can do and where we can go and how we can do it. So that's really been the motivating factor for me in all of this.
Thank you, Edie. You know, it's for us here in the Total Care program. Again, you know, it's really our community gym and, you know, our patient advisory council and, you know, really our care partners and patients who've really helped us find direction for this program and kind of move it in the direction that is best for our community here. And I, you know, do want to mention that these deep dive virtual events that the Total Care program has been organizing are really about bringing experts and you know our partners, community partners nationwide to our Dallas community and our patients and care partners at UT Southwestern and beyond. So I really hope that we can continue this conversation, continue this partnership, and please look out for more of these deep dives. Lots coming up in July as well. We have two very exciting speakers coming, speaking about family therapy and mental health, which is also such a huge topic. With that, Edie, if you have any last thoughts, or Polly, if you have anything to share, and then we will put this recording online, which will, you know, garner a lot of conversation as well, I hope.
No, I just want to conclude with a word of encouragement that people don't limit yourself to what you can do. And don't let anybody tell you what you can and cannot do, because I've met people who have, I met an astronaut who walked in outer space with Parkinson's. I've met people who run marathons and who have climbed mountains. And I haven't done any of those, but I still have had many, many victories. And that's what Davis Phinney is all about. He encourages you to put the arms up and say victory for whatever you have accomplished. It's not what anyone else accomplishes, it's what you do. And I want to thank you all for your high praises of me, but I'm not the hero. You are the group. When I talk to a group of individuals, the fact that you've attended the meeting, gotten out of bed, and maybe had to overcome some obstacles in getting prepared for it, it shows me that people care enough to attend, and you're there for one another. You have a wonderful community. So you all are the heroes in this, not me. So, and I appreciate the opportunity to be a part of the program today.
Thank you.
Couldn't have said it better. Let's end with that. Thank you, Edie.
Thank you so much.